emotions, like you start to cry suddenly or become very emotional and you don't even understand why? Do you have low self-esteem and low self-image, or a very negative view of relationships and the world at large? You might be suffering from something which is called as complex PTSD. It is a psychological disorder which is usually seen in relationships, relational abuse, where there is prolonged and recurrent abuse. In this video, I would like to tell you about the 5 symptoms which are characteristic of complex PTSD. Hi, I'm Dr. Meghna, a holistic psychiatrist and founder of Holistic Mind Clinic, and let's deep dive into understanding if you or your loved one might be suffering from complex PTSD.
Complex post-traumatic stress disorder is a severe and debilitating condition that arises from prolonged, repeated trauma. Trauma is usually relational, caused by a parent, partner, or in Indian context, the joint family dynamics. Trauma is usually verbal, emotional, physical, spiritual, and sometimes sexual. It is the silent health epidemic of our times. Welcome to our exploration of complex post-traumatic stress disorder, or CPTSD. In this video, I will take you through 5 characteristic features of CPTSD. They are emotional flashbacks, toxic shame, self-abandonment, a constant inner critic, and social anxiety. Our first segment focuses on emotional flashbacks, a distinctive feature of CPTSD. Unlike typical flashbacks that involve a re-experiencing of the traumatic event, emotional flashbacks plunge the individual into the intense feelings experienced during the trauma. They are sudden and often prolonged attacks of overwhelming or confusing emotions from their past. The person might not even realize that they're having a flashback, as they are not often tied to a specific event or memory. Next, we delve into toxic shame. This is an intense feeling of being fundamentally flawed and unworthy of love and belonging. Individuals with CPTSD often carry a deep-seated belief that they are bad, unlovable, or undeserving of good things. This toxic shame can lead to self-destructive behaviors and poor self-esteem, further exacerbating the condition. Our third segment investigates self-abandonment and passive suicidality. The chronic nature of CPTSD can lead to a sense of hopelessness and despair. Individuals may abandon their own needs, desires, and health in a form of passive suicidal behavior. They may neglect their physical health, engage in risky behaviors, or fail to seek help when they need it, subtly signaling their deep-seated wish to escape their pain. Moving on to our fourth segment, the development of the inner critic. This is a harsh internal voice that constantly criticizes, judges, and devalues the individual. It's a product of the repetitive negative messages that were internalized during the traumatic events. This inner critic can be relentless, further impairing the individual's self-esteem and reinforcing feelings of shame and unworthiness. Our final segment explores social anxiety. Individuals with CPTSD often struggle with intense fear and avoidance of social situations. They may worry excessively about being judged or rejected, or they may experience severe anxiety in everyday social interactions. This can lead to isolation and loneliness, further reinforcing the cycle of trauma and distress. In summary, if you are suffering from characterized by emotional flashbacks, toxic shame, self-abandonment, and passive suicidality, a harsh inner critic, and social anxiety, you might be suffering from complex PTSD.
Remember, these are not symptoms of your emotional weakness, but these are symptoms of a psychological disorder which is called as complex PTSD. And it is possible for you to reclaim your life, your self-image, improve your self-care, and develop that hope, a positive attitude towards the world and towards yourself. Reclaim your trust, reclaim your hope. It is possible through therapy and medications. All the best to you.